Good afternoon, everyone. I'm Alisa, Haushalter, Director of the Shelby County Health Department. And on behalf of Mayor Harris and Mayor Strickland, I want to welcome you to the Joint Task Force update. Today we have a variety of people who are going to present. So we have G. Van Knight, who is here with Red Rover to talk more about communications, but specifically about our updated website. And then myself and Dr. Randolph and David Sweater here, I'll give updates on data and a few talking points relative to where we are in the pandemic and actions that we need to take as a community. Dr. Randolph will give some key updates as well, and David will be available for questions along with the rest of us. So I'm going to turn it over to G. Van Knight to give updates from Red Rover Communications.
Thank you, Dr. Haushalter. Continuing the drumbeat of messaging has never been more important now as we're seeing rises of cases across the country. Since our last update, the health department's messaging has reached broadcast, local TV, cable and satellite radio, newspaper, print, and social media, and will be launched in the coming weeks at gas stations and billboards across Shelby County. Red Rover has also been proud to partner with another Memphis-based minority-owned agency, Prodigy Arts, for the video production and animation on this campaign. Prodigy Arts shares our commitments to the health and livelihood of the Shelby County community. I'm here today to highlight the website shelby.community. If you haven't had a chance to recently visit shelby.community, it has grown over the past month and evolved into an expansive resource for COVID-related information. Here you can find information on the latest health directives, including interviews with Dr. Haushalter and how to safely celebrate Halloween. Frequently asked questions, links to testing information, resources are available to Shelby County individuals, and resources are available for Shelby County businesses like the Our Beautiful Comeback and Our Faithful Comeback grants. The information on Shelby.community is updated weekly, sometimes daily, with information, and we encourage everyone to check out Shelby.community for the latest resources. Back to Dr. Haushalter.
Thank you, G, and thank you to Red Rover for all that they're doing to help improve our ability to get information out to the public on COVID-19. So again, I'll give some brief updates on data and then talk a little bit about where we are in the pandemic and key action items that we can all take. As of this morning, we had 36,793 cases, and to date we've experienced the loss of 566 individuals in our community. We've had an increase of 301 cases over the past 24 hours. But what I want to point out that I think is most important is over the last week, we've averaged a little over 300 new cases per day. Most days we've been hovering around 200 new cases, but we've had at least 2 days where we know that we've had over 400 new cases. So anyone can do the math and know that our numbers are going up. We are seeing significant increases in a variety of areas, and our 14-day trend is clearly upward. Our reproductive rate at the current time is 1.24, which is significantly higher than 1 or less than 1, which is our goal. Our weekly test positivity rate is increasing, and our duplication rate is shortening. And if you recall, we talked about duplication rate a lot in the very beginning of the pandemic. That's how quickly we double our cases. And the reason that's important is that if we've had over 36,000 cases, if we double that in a very short period of time, we will quickly be at over 70,000 cases. At the current time, we're estimating that those numbers could be that high by the end of November. So I think in the last few weeks, everyone has heard me say that I've had some concerns about where we were. We're at a pivotal time, or we're at a pivotal time in the pandemic for several reasons. One, we had seen steady decline in Shelby County, but we also know that there were changes happening statewide and nationwide. So at the current time, we are at quite a different place than we were in March. And even when we were at the end of June, when we implemented several policies, including the mandatory face masking. What's different now is that we have significant transmission in surrounding counties that will influence Shelby County. That includes influencing our hospitalizations, as well as people come in and out and back and forth between counties. So our ability to reduce transmission is quite different than it was, again, in June and early July, and then obviously in March at the beginning of the pandemic. Why that's important is that our current numbers foreshadow a very challenging fall. And I want to be very clear and direct about that we do anticipate this upcoming weeks and months are going to be exceptionally challenging for our community. But what's most important is that we can all take actions that will reduce that impact in the challenging times that we're likely going to face. So I want to reinforce some things that I've said before, and these are strategies to protect ourselves as well as our family members and our community at large. We do know it's been a very challenging year for all of us. This is an unprecedented time. We haven't seen a pandemic of this magnitude really for a century, so we're all challenged with doing the best that we can to move forward. But I want to reinforce the importance of masking. We do know in Shelby County, well over 90% of people are wearing masks correctly in public places, and that's positive. But I want you to think about where else you need to wear a mask, particularly as we look at protecting vulnerable populations. If you are in a household that's multi-generational, you actually want to wear a mask when you're around your seniors or those who are vulnerable to reduce the likelihood that they may be infected if you have COVID. If you're visiting others that you don't live with, consider wearing a mask and assure that you're social distancing while you're in that particular household. I'm going to reinforce hand washing, which we've talked about quite a bit. And we're also going to reinforce the need to get flu vaccine. Anyone over the age of 6 months should be vaccinated. I want to focus a bit on testing. We still have significant testing capacity in Shelby County, and it's being underutilized. So it's really important, one, if you have any symptoms, mild or severe, that you get tested. If you've been a contact to somebody, get tested. If you think that you've been in a high-risk environment, get tested. If you live in a community that has high rates of transmission, and that information is available on our website, then I encourage you to get testing. We'll talk a little bit more later in the week about assurance testing, or what we call targeted surveillance testing, and how businesses and others can use this tool in the toolbox to identify cases early to further reduce transmission. But I also want to focus on a few other things that we talked about quite a bit at the beginning of the pandemic and less in recent weeks and months. It's really important that you make sound decisions about travel, and whenever possible, limit your travel. Again, there's transmission occurring not only in Tennessee but all over the country. So making sound decisions about whether or not you want to go to a community where you know there's significant transmission. You want to limit your attendance at public and social gatherings, and particularly if you are going to a gathering or you're hosting a gathering, to keep the numbers exceptionally small. For example, if you have something in your household, you really should limit it to your family household, those who live in your home, as well as those from one other household. But you still want to social distance and potentially wear a mask, particularly if there are high-risk individuals in the group. But I also want to reinforce that while we've heard a lot about asymptomatic individuals and their ability to transmit COVID, what we know in Shelby County is the majority of people have symptoms. Approximately 70% of individuals that we looked at in a small cohort had symptoms. Those individuals continue to be out in public and engage in their regular activities while they were symptomatic. So if you don't take any other message out of today's session, please, if you have any symptoms at all, stay home and get tested. For example, we do know that this is allergy season for many people, and allergies and asthma may mimic COVID or vice versa. And we know this is flu season. We don't have a lot of flu in Shelby County, but we do have flu. Again, the symptoms are very similar. So if you have mild symptoms, when you're beginning to not feel well, you kind of say to yourself, this is a day I'm not feeling like myself. That's the day we really want to encourage you to get testing. We're not going to be able to contain the virus unless we're able to identify people early on who are positive and get them isolated. So with that, I'm going to turn it over to Dr. Randolph, and then, again, David is here. We may have him say a few things if we have time, and then we'll open it up to questions.
Thank you, Dr. Haushalter. Greetings, fellow citizens of Shelby County. It's Dr. Bruce Randolph, Health Officer, Shelby County Health Department. Just want to highlight a few things. Certainly, Dr. Haushalter has covered one of the major points, and that is due to our uptick, we must wear our facial covering and mask at all times possible. Really, in the home, outside the home, wherever you are, you should have on that face mask. Also, I want to just reiterate about the point of staying home when you're sick. If you've been identified as an individual who's infected, you're in isolation, and you are under our orders to be in isolation. And we want to remind you that if you violate those orders and disobey the directive, then you can be in jeopardy of further legal actions, including a misdemeanor. Also, those who are in quarantine must obey the directive of remaining home in quarantine. And just for a reminder, if you're in isolation, it's for 10 days, which at the end of the 10 days, you should be 24 hours without a fever and 24 hours without any symptoms. And likewise, if you're in quarantine and non-household member, you're 14 days of quarantine. It's very important that you adhere to this. As I stated, we are monitoring the numbers very closely. Currently, we do not have specific plans of any reverse in our course, but we are discussing things that we may have to consider in the upcoming health directive that will be issued at some later date based on the direction in which our numbers continue to trend. I also want to remind people that we are still reviewing plans, reopening plans. We're receiving a lot of them. We'll want to also encourage you and to remember, if you are adhering to the health directive, following the safety measures outlined in the health directive, you should develop a plan. You don't necessarily have to have it approved before by us if it is in accordance with the safety measures outlined in the health directive number 14. You can find it on our website, shelbytnhealth.com. Last thing I want to just highlight, you may have heard in the media that there has been some questions about the criminal courts, and I just want to simply report that I've been in communication and with the judges, and we're working together to come up with a plan to address this whole issue of having trials in a safe manner, and more to come on that in terms of specific guidance, any directive related to the courts. Currently, all the courts and government agencies within Shelby County, as well as other individual and business services, should be operating in accordance with the Health Directive number 14. With that, I will invite Mr. Sweat to come and share what other data or information he would like to share, and then we'll open it up for questions.
Thank you, Dr. Randolph. So in terms of other things, as was mentioned earlier, 36,793 cases diagnosed to this point, with 301 new cases yesterday. But when we look over the past week, we see that 7.2% of all the tests that have been performed in Shelby County have tested positive, and that includes duplicate tests. People have been tested more than once. But when we look at people testing for the very first time, 15.3% of the people presenting for the first time to be tested positive in the week that ended October 17th. So there are several indications, and when we look in our surrounding communities, the only community in the surrounding area that is not in the red as far as the global Harvard Health Metric Institute metrics is Tate County, Mississippi. So if you live anywhere in the Mid-South area, you can basically assume that you are living in a county where we consider it to be a high risk of COVID transmission. That's in our urban county, Shelby County. It's in our rural counties. It's everywhere in the Mid-South. So as I said before, whether you live in a community that has a mask mandate in place or you don't, as an individual behavior, we would urge you to wear a mask anytime you're out in public and follow all the guidelines and pay attention to this situation. It is rapidly changing and evolving. And with that, I'll open it up for questions.
Kelly Rover, WMC.
Hi there, good afternoon. I'd like to ask a little bit about, Dr. Haushalter, you mentioned at the County Commission yesterday that one day last week at one of the hospitals, there was 40% of the admissions there were people from outside Shelby County. I just wanted to know if that is what is echoed at other hospitals as well, and where exactly are these people coming from? Is it West Tennessee? Is it Mississippi, Arkansas, or, across the Mid-South?
So we are a large metropolitan area, and as we all know, that many rural communities have lost their hospital systems in the past probably decade. Many of them in the last few years, but many over the course of a decade, so that when individuals get sick, particularly if they need infectious disease or specialist services, or if they need intensive care services, they're going to come to the closest metro where you have larger hospital systems. So we draw from Arkansas, Mississippi, and all parts of the western part of Tennessee. So all of those communities are represented in our local hospital systems. Our local hospital systems serve all of those communities. It's not any one particular hospital. I just want to point out that was one day in time. We were really curious as our hospitalizations were going up to see if this was a reflection of Shelby County admissions or other counties being admitted into Shelby County. And that one hospital was at about 40%, another hospital was somewhere a little bit under a quarter or 25%. And so we know on that given day, a significant portion of people with COVID or admitted for COVID were from surrounding counties. Your next question, please.
Yes, and staying on hospitalizations, as the surge kind of continues, it looks like when we look at the 24-hour case totals, are hospitalizations still going up? I did get some numbers, and I wanted to see if you could confirm them, that at this point it's around 87% acute care beds taken and 90% of ICU. Does that seem to be the numbers that we're dealing with right now when it comes to hospitalizations, and is that a concerning percentage if that is the case?
So I don't have the numbers in front of me, so I'm going to say yes, those sound about what I heard this morning, approximate. So yes, they are concerning, but the reason they're concerning is what we talked about earlier. Our cases are going up in Shelby County, and our predicted cases in the near future are going to be very high. And so we've got to get the numbers back down, particularly the reproductive rate and duplication rate, so that we can protect those hospital beds. Clearly, we do have the commercial appeal as building as an alternate care site. That's prepared in the event that it needs to be opened. We have always had an EMS surge site as well, so that if the emergency rooms are getting full, we have an option there as well. So they stand ready, and I believe our community will respond if our numbers get high. But we want to really reduce those numbers so that we don't overburden hospital systems.
Brad Broders, Local 24.
Good afternoon, everyone. Just for if these numbers don't stabilize and go down and continue to go up, in your view, how close are we right now to reinstating restrictions, and what restrictions specifically would likely be addressed first?
Good afternoon, and I anticipated somebody would ask that question. So we are actually exploring all of our options. What I want to say is what I said earlier, is that it's quite different now than it was in March and when we issued additional restrictions in June and July. Whatever we do in Shelby County is going to be impacted by the surrounding counties. So when we did the safer at home orders early on, both the city as well as the health department's health directive, we had very limited transmission in the surrounding counties. So now that we have high transmission rates in the surrounding counties, to close things down, we have to really judge whether or not that's going to have impact at a population level, because people come back and forth across the county borders. So we're looking at all the options. We're also reaching out to colleagues in some of the other big metros to see what their thinking is, so that we make a sound decision that reduces transmission but doesn't really have negative impact on the economy unnecessarily. So if we were to close anything down, we have to know that it really is going to make a difference. The things that we talked about earlier are those things that have to do with individual choice, which is why we've talked about that considerably. We do know from our local data that people are symptomatic and continue to go to work. We could shut down a lot of places, but that isn't going to make a difference if people continue to go out in public when they're symptomatic. So I urge people to stay home if they're symptomatic at all. I also urge employers to do screenings of their employees, but also to pay attention to their employees, and if someone is ill, to exclude them from the workplace. And then, as we've all noted, the importance of masking, and those are the things that are going to make the most difference at the current time. We will continue to look at options, and we will clearly let you know when we have made any decisions.
Thank you. And as a follow-up, sure, thank you. And you or David might be able to help me out on this one. I know you've talked in recent weeks about specific zip codes in the county that are seeing upticks and that stand out. Do you have any latest zip codes, areas of the counties or the suburbs that are seeing abnormally high cases in the last week?
So I'll make a few comments and I'll turn it over to David. What we are seeing now is what we would have anticipated. In any metro area, you see the first cases in the most congested population area, so that's the inner city area, and it tends to move out. So now what we're seeing is increased transmission in the municipalities, particularly in East Memphis and in Millington. But I'm going to turn it over to David because he may have a little more detail.
Thank you, Brad. Yes, as far as geographically, we see the epicenter of the epidemic has shifted eastward in the county compared to where it started out in March. But right now, the areas that are most active would be considered East Memphis, the area right around the University of Memphis, and then the zip codes just to the east of that. Also, the Hickory Hill community and the space in between Hickory Hill and Collierville that borders Mississippi, so in the southern eastern portion of the county. Those areas are where we're seeing the highest rates of cases, but we're seeing pretty high rates throughout Shelby County. And as was mentioned before, this issue of cross-border, when you look down into, on a per population basis, when you look into northern Mississippi, some of the counties that border us to, just south of us, they also are having very high rates of transmission. And when we look, around Shelby County, Tipton and Fayette County, Haywood County, and other places are having high rates of transmission. So, as I said, it's the entire area. It's all of the Mid-South is exploding or having exponential growth of cases right now.
Dominique Dillon, Fox 13.
Hello. So I would just like to know, how much of an effect could Halloween and Thanksgiving have on an increase in cases, and what advice do you have for families?
So I'll take first stop and then turn it back over to the director. As far as Halloween, There's guidance on our website about how to have safe or safer Halloween and Fall Festival type events. I've heard anecdotally, just listening to colleagues talk about taking their kids to trunk or treat type of environment where they go buy cars, get candy and move on, and have very limited interactions, and the interactions are designed to be pretty safe. So right now, I'm pleased to hear that a lot of people are following those guidelines that are on our website and the CDC website about how to have a safe Halloween experience. Whenever we're talking about the family gatherings and social gatherings associated with the major holidays beginning with Thanksgiving, every year during flu season, this is the major thing that kicks it off, is when we have population mixing as people travel all around the country to convene and reconvene and mix with each other in holiday gatherings, particularly the ones that begin around Thanksgiving. So that is a very large concern of ours. And to the point that Dr. Haushalter previously raised, we would certainly encourage people to have smaller gatherings this year than maybe in some years, to be mindful of the vulnerable. And when we say the vulnerable, what do we mean? We mean individuals 55 years of age and older. We mean individuals with diabetes, individuals with heart disease, individuals with asthma or COPD or emphysema or any sort of underlying lung condition. Those individuals need to be very careful, and we as their loved ones and friends need to be careful about being around them. But for further comment on that issue, I'm going to turn it back to the director.
You go ahead, David, because we're almost at time.
Okay, all right, so go ahead if there's another question.
That's all. Thank you.
Katie Reardon, WKNO.
Hi, yeah, David, I'm wondering, based on your modeling, you spoke last week that these numbers of hospitalizations have actually been coming quicker than you guys had modeled. But I'm curious, based on current modeling, and if the trajectory doesn't change, at what point are you anticipating potentially opening the commercial appeal building?
Right, so the thing to remember about that, that's not our decision. That is a state facility, and the opening of that facility and the staffing of that will be a decision made by largely the Tennessee Department of Health, although we are engaged in conversation with them about that. And just last Thursday, one of the key doctors and directors there at Tennessee Department of Health who is involved in that decision-making process met with the health department and the local hospital CEOs. So that conversation is underway, but when it would be actually opened or activated is a decision that will have to be made in Nashville.
Katie, did you have a follow-up? Looks like we are just about at time. Are there any closing messages from any panelists?
Just reinforce Shelby.community.
Yeah, so Shelby.community is a great resource, and thank you to the folks from Red Rover for helping us stand that up and compile a lot of information in one place. Shelby.community, we'd encourage people to go there. And then once again, if you have any symptoms whatsoever, please get tested and then isolate at home and avoid contact with others just in case you may be one of the individuals in our community infected with COVID-19.
Thanks, everyone.